Hi, I am Gaurav Saxena, Associate Professor in IIMT College of Pharmacy, Greater Noida. Today we are going to discuss about a class of communicable diseases, zoonoses. As we all know, communicable diseases are a set of diseases which are generally acute in nature, that is, they are short-lived, they are for a short duration of time, and among them there are a class of diseases which are known as zoonoses. These zoonoses are diseases which are actually transmitted from the animals or vertebrates to humans. These zoonoses are one of the big health menace because lot of diseases which are communicated through these. Zoonoses can be agents like pathogens like fungus, bacteria, viruses, parasites. So all these can be causative agents, and the people who are supposed to be taking care of these conditions are those which are actually pregnant women, people who are immune compromised, suffering from chronic conditions like diabetes because they are liable to suffer from these diseases, as well as people who have pests like their domestic animals like dogs, cats, pigeons, parrots. All of them can be potentially cause of zoonotic infection. Now this zoonotic infection can be including like disease like your amoebiasis, psittacosis. All these diseases can be your zoonotic diseases. Now among the pests that we can have, they are cats. Cats can cause disease which is known as Q fever. There's disease which is like rabies. All these diseases can be caused by pets. Then there are pests like rats. Rats are, as we know, cause of dangerous diseases like plague. So what we can do, the health implication of these particular diseases are like economic implications. People do suffer from these diseases. They may lose their livelihood. Other part is they may suffer from permanent disability. Death can also occur in case the treatment is not provided. Among the ways to prevent these diseases are, first and foremost, is personal hygiene. When we have these pests, we should ensure that the litter boxes are actually clear, they are not dirty. That is one part. The other part is that if we have like pigeons, they cause psittacosis, which is again a zoonotic infection, and it is really dangerous. If we talk of like the other cause type of the infection can be when you're going for scientific research, like this African green monkey. Initially, the AIDS was a disease which was found in the African green monkeys, baboons, and when they were doing research on these, the AIDS virus was transmitted to humans. And now it has mutated and it is actually become a human disease. Again, there are other diseases which actually can transmit from humans to the pets. This is known as reverse zoonosis, and that's again also a big problem because these reverse zoonoses can again mutate and they can form a very big devastating issue if it is species jumping. If the pathogen jumps from one species to the other, the chance of health implications are huge. If we talk of historically, this plague was known as Black Death from time immemorial, and many cities actually lost their whole population because of this. And this particular condition, plague, has been seen in numerous countries. Now it is being controlled because of the better hygiene conditions as well as the pest management that we follow. Rats are one of the biggest cause of zoonoses. So that is one part. The other part that we can understand is that if we have these pets are be kept for entertainment purposes like dogs and cats, for security purposes, and then again we have these pets like buffaloes, cows, for economic reasons. These domestic animals can also be cause of diseases. Historically, we know that the smallpox, it was also used as vaccine. Pasteur identified this vaccine because they found that the cowherd men they did get these pustules of smallpox, and then it was transmitted to them, and then they got this autoimmune condition. They got this immunity against the smallpox because they were treating these cows and buffaloes. That is the good side. But the bad side is that if we are unable to identify the pathogen, the person may lose a life and the livelihood. So these are the few points that we understand about zoonosis. Apart from that, what we understand is because of the world trade, people are moving from one country to the other, as well as the animals are being moved from one country to another due to their economic uses. So that is a big problem. So for that, internationally they go for this quarantine. There is a specific period of quarantine where then the animal is kept in a restricted place, and if they have this so-called tropical diseases like your cisticosis, like malaria. Now, if the animal is carrying any of these pathogens, there is always a possibility that the country where it lands up may actually may not have that particular disease and may become infected. Case to point is Zika virus. Zika virus was one of the conditions which was found originally in Brazil, but now it is found like in countries like Vietnam, India, and that is one of the conditions. Discussing about the people who should be aware of this condition is pregnant women as well as old geriatric people, because they are normally considered to be in a frail state of health and they can get infected very easily. Especially in case of pregnant women, if they are in touch with like say cats, there is this cat scratch disease. There is a possibility that they may lose their fetus due to the miscarriage. So these are the factors that we have to understand when we talk of zoonosis, especially in case of communicable diseases. And the other factor that we have to understand is that there is always a possibility of being prevented from these, even though we may have pets. If we maintain proper hygiene of the pets, we may clean the litter boxes properly, and we may use gloves when we are taking care of the animals and going for proper hand wash procedure. So that is all that I have to say for the day, and happy learning. Thank you.